Welcome to a new episode of Médecine Interminute. We go straight to the point. The subject is bravely made clear and often illustrated. Today's topic is laryngeal nerve injury. An anatomical reminder of the innervation of the larynx, reminder of the extrinsic and intrinsic muscle of the larynx, functioning of the vocal cord, classification of laryngeal palsy, superior laryngeal nerve palsy, inferior laryngeal nerve palsy, laryngeal palsy at birth trauma, and we will end with spasmodic dysphonia. The vagus nerve comes for the nucleus ambiguus. It gives motor fiber, which give the pharyngeal nerve and pharyngeal plexus, and superior laryngeal branch that give internal branch and external branch. And it ends with a recurrent laryngeal nerve. The right vagus nerve gives rise to the right recurrent laryngeal nerve, which hooks around the right subclavian artery and ascends into the neck between the trachea and esophagus. The left vagus nerve enters the thorax between the left common artery and the left subclavian artery to descend to the aortic arch. It gives rise to the left recurrent laryngeal nerve, which hooks around the aortic arch to ascend between the trachea and esophagus. The superior laryngeal nerve consists of two branches, the internal laryngeal nerve, sensory, and supply sensory fiber to the laryngeal mucosa, and the external laryngeal nerve, which is motor. It functions to tense the vocal cord by activating the cricothyroid muscle, increasing pitch. To note, all other intrinsic laryngeal muscles are innervated by recurrent nerve, laryngeal nerve. Main trunk, external superior laryngeal nerve, and internal superior laryngeal nerve, and this is the recurrent nerve. Muscle of the larynx, there is two groups. Extrinsic muscle include digastric, styloioid, myloioid, and genoioid, and stylopharyngeus, salpingopharyngeus, and palatopharyngeus. The digastric and the styloioid muscle upper and out, myloid muscle just upper, and genoioid muscle upper and in, and thyroid muscle is down. Depressor muscle include sternothyroid and sternoioid. This configuration led us to understand how it works. This is the thyroid cartilage, arytenoid cartilage, and cricoid cartilage. This little boy is looking to the thyroid cartilage. Between the cricoid cartilage and arytenoid cartilage, there is muscle, and the muscle is the cricoarytenoid muscle. Between arytenoid cartilage, there is a muscle, and the muscle is interarytenoid muscle. Between cricoid cartilage and thyroid cartilage, there is a muscle, and the muscle is the cricothyroid muscle. Between arytenoid and thyroid cartilage, there is a muscle, and the muscle is the thyroarytenoid muscle. The cricothyroid muscle is to open vocal cord. The interarytenoid muscle is to close vocal cord. The cricothyroid muscle is to stretch vocal cord, and the thyroarytenoid muscle is to tense vocal cord. Tense vocal cord, stretch vocal cord, open vocal cord, and close vocal cord. Vocal cords are two flexible bands of muscle tissue that sit at the entrance of the trachea. When a person speaks, the bands come together and vibrate to make sound. The rest of the time, the vocal cords are relaxed in an open position so you can breathe. Paralysis of both vocal cords is a serious condition. This can cause vocal difficulty and problem with breathing. Abduction of vocal cord, adduction of vocal cord, elongation of vocal cord, shortening of vocal cord, and tense of vocal cord. From the superior view, there is a glottis, epiglottis, and thyroid cartilage, cricoid cartilage. Vocal cords are in green. A superior laryngeal nerve palsy changes the pitch of the voice and causes inability to make explosive sound due to the paralysis of the cricothyroid muscle, the blue one, which is responsible of the stretch of the vocal cord. If no recovery is evident 3 months after the palsy initial present, the damage is most likely to be permanent. Superior laryngeal nerve, high pitch. The external branch is susceptible to damage during thyroidectomy. Cricothyroidotomy, as it lies immediately deep to the superior thyroid artery. The ability to produce pitched sound is then impaired along with easy voice fatigability. Irritation of the internal laryngeal nerve results in uncontrolled coughing, usually as a result of food of water. The lesion of this branch in chirurgy is associated with the loss of the laryngeal reflex of cough and an elevated risk of aspiration pneumonia. 10% of vocal cord palsy are caused by birth trauma, hoarse cry, stridor, risk for aspiration, feeding problem. Recovery often after 4 to 6 weeks, sometimes longer. Classification of laryngeal palsy may be unilateral or bilateral, may involve recurrent laryngeal nerve, superior laryngeal nerve, external, and internal. It could be median, paramedian, intermediate, slight abduction, and full abduction. Let's move on to spasmodic dysphonia. Spasmodic dysphonia or laryngeal dystonia. The muscles that generate the voice have a spasm. This causes pause of interruption in the voice. It can make a person difficult to understand. The voice seems stained or almost unable to speak. The onset is gradual and lasts a lifetime. Life expectancy is, however, normal. The cause is unknown. Risk factors include family history. The trigger, infection of the upper respiratory tract, lesion of the larynx, overuse of the voice, psychological stress, underlying mechanism involves the basal ganglia. It is a type of focal dystonia. Treatment can improve symptoms. Injection of botulism toxin into the affected muscle of the larynx. Improvement after a few months. We can use voice therapy, amplification device, and sometimes indication for surgery, but is limited. Thank you for watching this episode of Medicine in 3 minutes. Would you like to click the button like and subscribe? Your comments are very welcome.